Dr. Alber, I think you can get started whenever you're ready.
All right, I'm going to share my screen here and hopefully everyone can see it right. And then I'm going to try to move this off my screen and it's going to take me 5 minutes. Okay. All right. Well, hi, I think I've met most of you before in this class. I think Nura might be the only person I'm not sure I've met before, but it is, hopefully I will meet soon in one of my classes here. But I was asked to come in here and talk a little bit about public health advocacy. So I am a professor in our department, and you'll likely see me sometime because I teach a lot of classes, but I also chair our local tobacco coalition, and I'm also the associate director for advocacy and health communication for the Center for Health Research. So I'm really in charge of doing advocacy efforts, either local, state, and we do something federally too on behalf of the center. So today I'm going to go over a couple of things. I'm going to try to keep it brief and have an activity here, but we're going to talk about what public health advocacy is, and then some ways that you can get involved. And then I'm just going to provide you some examples, because I think that's one of the things getting involved in advocacy is a little bit intimidating, especially when it comes to like contacting an elected official or making a public statement. It seems like it's pretty intimidating, but honestly, like once you get down like what you normally do, it becomes kind of second nature. And then we're going to go through an activity that's like pretty easy to do, and I'll give you some resources. So feel free anytime to interrupt me if you have any questions. You can also put them on the chat box, although I'm honestly pretty bad at paying attention to the chat box. So maybe Nadia or someone could interrupt me if something happens there. So just to give you a brief overview, according to the American Public Health Association, which is our national organization for representing our field, an advocate is anyone who's arguing for a cause, either supporting it or defending it. So advocacy is the act of trying to support some type of issue or cause. So a lot of what I'll give examples of today are related to tobacco control. And that can be me supporting a new law or actually being against it if I think it's detrimental as well. And we are ultimately trying to influence the way the public is thinking about this cause, or policymakers as well, because we're trying to get them to act on it. And anything I'm talking about is generally related to public health policy specifically, but there are other ones that might fall out of that you could be doing with advocacy. I do want to point out, though, there is this idea of lobbying, and that's going to be direct communication with policymakers about specific legislation and expressing your views on behalf of an organization. So the American Public Health Association, for example, they actually do have a lobbying arm. So they do like contact and meet with state legislators, or they do actually contact like local and state representatives and have meetings with them on behalf of APHA. So that's a little bit different. And in California, lobbying would also be if you're getting paid to do that directly, like if you're being paid to contact your legislator to advocate for them to support a specific policy. And I just bring this up because if you do work, and I know at least one of you technically work for a local government agency, you do have to be a little bit careful when you're doing advocacy work. It's totally fine for you as a citizen or as a public health advocate to come out and exercise your right to speak about how you support a cause. If you're for or against a policy, to contact a state legislator. Just know that sometimes, depending on who you're working for, you might want to just specify, this is my own viewpoint. This is not on behalf of my organization. So for example, at the local level, with the Tobacco Control Coalition members, we do voice our opinion a lot, but the tobacco control staff are not supposed to do that. As a tobacco control staff, they're not supposed to tell, the local city council what to do. They're just there to provide information and facts. So that's just something to keep in mind if you do go work for a state or local health department when you decide to get involved with advocacy, which is totally fine. Just making sure you're never representing yourself as a part of the organization unless they've said that's okay. So how can you get involved with advocacy? What are some ideas? How do you know? Like, how do you know right now, like if you wanted to go advocate for something for public health, what would you do?
Find a coalition.
Yeah, you could definitely find a local coalition. You can even create a coalition. That's definitely happened for your specific issue if they don't have it. So obviously I talk about the Tobacco Control Coalition. When I was in Philadelphia, I was a member of the Hepatitis B coalition that was very focused on that specific issue. Anna put email policymakers. Yeah, definitely. At the local, state, federal level, you can email them. At the local level, it's much easier to get their actual email addresses. So like your city council members, the board of supervisors, which is for unincorporated areas within SLO. But all of them at the state and federal level, they also have like a contact me here. I often will mail letters to federal as well, just because I like want it on paper that they got it. And then there's also the state of California just recently opened up. They have a portal now where you can officially submit a letter to like the health committee or to a specific senator, which I really like because I feel like those fill in the box, contact your senator and you can't attach anything is not as good, but definitely you can do that. Anything else that you can do?
You can call senators. I've done that before.
Yeah, you can definitely call, and more people that call, they actually do have to log all of that. And a lot of times they might just like log what you're specifically calling about. So if they know they're getting a lot of pro calls, they're gonna know, oh, a lot of our constituents are worried about this specific thing. Sydney, did you have something to add?
I was just gonna say, like, you could, at least in the educational realm, like, you can ask like different faculty about like what they're involved in if you wanted to kind of get involved that way, like through advocacy, or just see like, or they could just give you more information about that, or just talking to your peers about like what like organizations might be around that like you haven't heard of before.
Yeah, and that's very much true. I mean, we know that different faculty are in very much involved within the community. It just depends on what they're interested in. So for example, if you're interested in like nutrition, Dr. Zhang is definitely a member of some local organizations that are going to be promoting healthy eating or access in the community. So that is a great idea. It's trying to figure out like, how could I get involved locally? So those are all great ideas. You don't have to do all of them. You can like do some of them, whatever makes you feel comfortable too. So I just have some examples. I think, oops, a lot of you have already talked about. So writing a letter or submitting an email, definitely one. They have to log all of that. And like sometimes it's a numbers game to try to get their attention there. You can also do, I know this one sounds a little bit more intimidating, but you can deliver or submit testimony at a meeting. So like a city council meeting. You can also, if there's a public hearing at the state or federal level, you can show up as well, as long as the public is allowed to come. And what's kind of nice right now in COVID times, and I kind of hope they do something similar, is you can just like record a 2-minute video and submit it. So you don't have to be there. And I've done this. I don't know how many of you, if any of you have went to the local city council meetings, you can make up to a 2-minute public comment on anything, on a specific thing that their agenda item, or at the very beginning too. If you just want to say, hey, you're not looking at this, we want you to talk about it.
I have a quick question.
Yeah.
Where do you see like the meetings like for the council? Like where can we access that?
Yeah, so I could actually send it. If you go to like City of SLO, they actually have a sign up to get contact about any city matters. And they'll actually email the agenda out about the city council, and actually like any city notices, which is kind of nice. I like that too. So like updates on regulations related to COVID. But it's usually like City of SLO, the Board of Supervisors, which would be unincorporated county areas. If you just Google that, they'll come up on their website, and they will at least have an agenda. Like Morro Bay doesn't have a listserv, but if you live in Morro Bay or you want to comment on something, they do have the agenda meetings on their website. Very low tech like for them. And you can also always reach out to a city council member directly too if you have questions about that too. Just thinking, there's definitely for like California, any of your representatives, there's a website you can say, how do I find my official? And it will come up and it will help you locate who's your actual elected official. So who's your state senator, all of that type of thing. Any other questions? Another thing is you can submit comments. Like, so for example, when and this one's a little bit higher up and it can be more difficult to even know this is happening. But for example, when the FDA was thinking about banning e-cigarette, some flavors in e-cigarettes, they actually had a public comment period that you could go and submit to FDA what you thought about that specifically. Those are a little bit harder to even know about. You have to be like searching for them, to be honest. But if you're a member of a coalition, that's how I knew about that, because through the coalition, other people brought it up and said, this is happening. And just sharing information and speaking to friends and family, sharing things on social media, it's just another form of advocacy, trying to get people aware, especially if you want them to vote in a certain way. So those are all different ways that you can definitely be a public health advocate. So I'm going to give you some examples because I think like the letters can be intimidating, but this is mostly what I do because they put these on official records. So we actually have one for the public health department. I'm sorry, the public health club that they wrote last year. So the club actually did contact our board of supervisors last year. And I just want to point out some things like, so in this letter, they did email this directly to her because Debbie Arnold actually had an email address, but they clearly specified to the district that who would actually represent them. So this is a specific one of the board of supervisors. And then they upfront identified we're supporting the proposed amendments, like very specific. This is what we're about, what's being brought up and what we want to support. Then they gave like a bunch of information about like why they support it. So this was about prohibiting e-cigarettes in unincorporated areas of SLO County, which did actually pass. But they here gave some information like, as college students, this is what we think. So they brought it from their own perspective. And then they restated that main message again, like, please support this. This is what we want you to do. So it's very clear what we want you to do. In another example, this is one that's actually to an assembly member where I wanted to show you that we don't always support policies. The last one we were trying to support, but this is pretty recent. At the state level, they were trying to introduce what we call PUP laws, which are, it sounds funny, not like a dog, but they're purchase, use, and possession laws. So basically they make it illegal for people under 21 to have tobacco, which sounds good. But what we've found is these are mostly used to disproportionately target specific groups, such as people of color, LGBTQ plus communities. They just have much higher rates of these being used to arrest them. So we definitely did not support this. So again, like we wrote specifically to our state senator, and we also did send this to the health committee at the state level that was going to be hearing this. And then we upfront said what we wanted and that we were saying to oppose it. And then we provided some explanation here about, well, basically that it's discriminatory because it is, and that's what we said. And then we restated it again. So that's just an example. There's a lot of ones that are upfront that you can find that are like pre-written for you if you need more information about how to write these. And then I wanted to provide an example of a federal one that we mailed because we can't actually do that. But in this one, this is very recent. We actually just sent this last week, but we're urging support for the George Floyd Justice of Policing Act. And this one is from the Center for Health Research. So we did really just focus in on the evidence related to that bill specifically, and obviously the issue with policing. But I wanted to note in this one specifically, we actually did state that the views expressed in the letters are those who signed it and not of Cal Poly necessarily. So this is just an example of, again, like if you all were writing it from the Public Health Club, I don't think it's an issue. But as we use the letterhead from Cal Poly, we just wanted to make sure that this isn't a letter being sent to reflect Cal Poly. This is like our views specifically. So that's something that you can just write very like, well, I put it in the notes, but you can write it in the letter too, if you need to, and you're working for an agency. Some And any questions though about writing a letter?
Are there like templates you can follow online?
Yeah. If you just kind of Google like support for or advocate for like this one, I took a lot from the American Public Health Association. I looked at what they wrote. And then for tobacco, for example, if I look in like, you know, we just were writing one for the referendum that's going up against the flavor tobacco ban. They, the American Lung Association has a template for you to use. And I'm going to show you some too. Yeah, and you can totally copy and paste because I mean, in the reality of it, they at the local level, they might read it more. At the federal level, it's more of a numbers game of like you're saying for or against it, and that's really what they're going to mark with your letter. So make sure it just, no matter what, making sure it's clear what you're asking them to do. Any other questions about writing a letter? Another thing you can do is post on social media or talk to friends too. So like this is an example from the Slow Youth Coalition. It's related to the flavored tobacco ban that was passed, and now the tobacco industry has gotten enough, well, we'll see soon, if they got enough signatures to put it on a vote for the state, to state citizens to vote on. But we were just talking about this and we're talking about big tobacco. So you can also, there's a lot of social media messages. And actually, usually with these, if you can find a national organization or a different organization that has a really nice one, I would just use theirs because they always look better. So for example, with 793, SB 793, Tobacco Free Kids Action Fund had like a bunch of stuff that you could just reshare. And it looks way better than anything I would make, I'm gonna be honest with you. So I want to do a little bit of an activity. So here's an example of a really easy and how one of the first things I ever did in advocacy. So the American Public Health Association, they have these action public health alerts that you can either sign up for or just kind of pay attention to when they happen. Let me see if I can send this link. So if you go ahead and just click on that, they have a couple of ones right now. And you'll be asked to put in your zip code to identify your representative. And then it actually creates a message for you and you can edit that message and then just send it, and it actually sends it for you. This is at the federal level for APHA. They don't do as much with state level. So I can do one. Oh, we always need more funding. If you took 265, you probably heard that a lot. So I'm going to do this one here. And what's really nice about it is it tells you who should actually get this. So it told me these are my state senators and this is who my House of Representatives. So I didn't have to go find that. It automatically knew. And the only other thing though is you do have to put your full address here too.
Do you have to put your full address because like they'll mail you letters? Because when I've reached out to senators before, they like email me a letter and then they mailed me like the same letter.
It's more to make sure it's going to the right person. But yeah, and they want to prove that you're an actual resident of that area. But yeah, because I've written to like Cunningham, like I now get a lot of emails and flyers from him. So yeah, that is the downside of it. You'll get some contact from them after that.
So you said that this is for the federal level. Is there anything that's like similar to this for the local and state level?
Not for like public health in general, but there are some like for like tobacco, for example, they do have ones that are set up automatically. And then a lot of times it will be for like very specific issues. If they have like some kind of campaign manager for or against this, they might have a website for you to use.
Okay.
And I definitely recommend getting it, but it is nice like at the local level if you can put a little bit personal touch. State, federal, it's unlikely they're going to read too much of that, to be honest. But it's good to like voice it.
Mm-hmm.
So in that, do you think like quantity is like really important? Like if a lot of people do it, like you said, there's more attention towards the issue.
Yeah, so basically like every time you call your federal senator, for example, or send them a letter, they have to track the number of times, right? So they will look at like usually tracked who did it, but if, for example, they're getting like 500 calls in a day about this one bill, that is going to bring their attention to that. Obviously people that they represent care about this issue. So that is a big part. And that's why a lot of times these agencies will put this out for us, like the American Public Health Association, and they'll put out an action alert, like, please go ahead and contact, because they're trying to get a lot of people to do it at once to bring attention to it.
If you contact them more than once, do they count each time, or do they count you as like one person who really cares about something?
I actually am not sure about that. I could ask them. We have some representatives on the coalition that come in, and I could ask them how they do that. I'm assuming that they probably track if it's the same person. But you can imagine on a phone call, you can't always do that. Definitely at like the state level, when you submit a letter, you do it under an account, so they would be able to track that it was that one person.
Does the APHA periodically update their action alerts? Like, do they choose new topics every few months or so?
Yes, yeah, they definitely do. And there is it's somewhere on there, you can actually sign up for it. So I will get like emails every couple of months, like asking me to contact my state representative or senator for the specific bill. And then they just have some up there in general that are there. Any other questions about this specifically? But this is like an easy way, I think, like if you're like, I don't have too much time and but I want to be involved in advocacy and I want to support this, you can do something like this. And I did want to mention that the Society for Public Health Education also has an action alert. Those are going to be more specific to health education, but there is a lot of overlap with APHA. So it's just another one that I'm a member of, and I do get their action alerts too. And I can also do that type of thing if I want to also be involved. And then I really like this link here that it is specific. Sorry, I do a lot of tobacco stuff. But if you look up the American Lung Association, they have a lot of tips, and then they just have a lot of examples too, like talking points, like how to talk to a state, like a local official, what you should say. That is I find very helpful. Of course, it's all tobacco control stuff. Sorry, I do a lot of that stuff. Still pretty important. But just being involved in your local community in general and getting on like alerts to see what's happening is also an important thing to do. Does anyone have questions about anything about getting involved or like how to do something?
Oh, Verly, you go. No, you go.
I mean, this is kind of like a weird question, but for example, like if I'm someone who's like passionate about like healthcare access in Santa Maria, but I'm not from Santa Maria, like, does that matter? Like, can I still advocate? But would my like say kind of be less just because I'm not a community member?
You can still do that. Like, for example, I definitely go to like Morro Bay city council meetings all the time, but I'm not a member of Morro Bay. But I mean, you can also say that like I visit Santa Maria and I'm nearby Santa Maria, but you are right that they will note that you're not a resident. You could, however, say like, I'm a Cal Poly Public Health Club member. Like it might be better actually for you as a club to go forward and say you're representing that club.
I have a question. If you like do research and like research informs policy, like how do you convey that research to like policymakers? Like, is there like a process, or like how does that work really?
Well, there's a couple of things that you could do there, but if you saw in like a Center for Health Research one, we do try to summarize like evidence-based research that would be relevant to that topic. And I do try really hard because, you know, you don't want to just be political, even if you're passionate about something. I try to always put what's like there is research supporting it. So just trying to put statements that are in a way that they would understand, right? So trying to write in plain language, even though they might be educated, they might not be educated in your area of study. So that's one way, is to write and summarize it. And I do know other agency like it's always better with like coalitions. Like there's like a statewide coalition for tobacco control, right? Coalitions, and they actually do submit reports directly, and they'll present on that report and try to meet with their representative to say, hey, here's this new data. But it's always better to have like an ask, not just say like, hey, I have this data, this is what the research shows. You got to say, and because of this, I want you to do this, if that makes sense. Any other questions? If you are interested in getting involved and like seeing what coalition work is about, you know, you're always welcome to come to the Tobacco Control Coalition members, even if you just want to see like what we, you know, like what is a coalition. We definitely have some new activity going. Sydney, you'll hear about it soon, where we're going to be trying to come out about the referendum and talk about that. It's this whole new thing. If you're interested, you can always contact me and I can add you to it. They meet online. It's every second Wednesday at 4 p.m. But we meet on Zoom.
Yeah, Anna, I can send you the coalition emails, or once we know. I think the next one's May 14th.
It is May 14th.
Okay.
Yeah, but there's lots of other like coalitions. Like there's a Healthy Working Community Coalition that's in town that like they're actually involved in like if a new development comes, like they'll actually look at their plan and make edits on it. And if you Google them, they have like a email me to tell me when the next meeting is, and you can just show up and try to be a part. That's what I did with the Tobacco Control Coalition. I just like came and sat in the back and listened for a while. And then now somehow I'm chair, but that's kind of how you just do the first step.
What do you do as the chair member of the coalition?
I organize all of the meetings, and then I do actually take the lead on any type of direct communication, because you know the tobacco control staff cannot do that. So I would take a vote with the rest of the coalition members to see if they support it, and then I would actually submit the letter. A lot of times, like I might like get EcoSlow if it has something to do with environmental, or Center for Health Research. So the latest one, we got the Teen Task Force on, so I would contact other coalitions because it's better if there's more on one letter to show that. And then I do a lot of meeting notes. So to be honest, I take a lot of meeting notes and I share a lot of information out to the rest of the coalition. All right, well, if anyone ever has a question, something you're interested in, you're always welcome to email me out. And just remember, like, even if you go into a healthcare field that you don't think it's public health, you could still always advocate for public health for the rest of your life, because you know how important it is.
Thank you so much, Dr. Alber.
Thank you.
All right, have a good day.
Thank you.
Thank you.
Thank you.
Hello.
Hello.
Hi. So I'm I'm supposed to be a freshman next year, and so I'm kind of just like coming and seeing how the club is, because I don't like know that much about public health. So I was just wondering if you could kind of give me like a general idea of like what this club is about and everything.
Wow, that's awesome. Thank you for coming.
Yeah, no.
Yeah, when I picked public health, I also didn't know what it was. I just saw the word health and I was like, that's for me. But once you like start taking a lot of the classes here, you learn that it's a lot about different putting together different programs and interventions to help not patient by patient in the way that you would in a healthcare setting, but more like population based. And there's so many different like broad realms. Like there's injury prevention, obesity prevention, there's worksite wellness, there's community health. You can go into epidemiology. And so in this club, what we more do is we do a lot of like we do resume workshops. We also always send information about different events or different opportunities that are available within the realm of public health. We also do a lot of educational things and different discussions. I don't know if anyone else wants to jump in to add anything I might have missed. There's a lot of research. Um,
Yeah, that seems really cool. I mean, thank you for giving me an idea. I'm just like a little nervous, but I feel like it's exciting at the same time. So
oh yeah,
thank you for like the info on that.
of course. Does anyone else want to add anything? Any of the other?
I just feel like, sorry.
No, go ahead.
For me personally, public health is the perfect combination of science and people. Like that's just how I visualize it. I love people and I want to improve people's lives, and I don't want to do that just one person at a time. I want to do it in a bigger picture, and that's what public health is about. It's about the bigger picture, and it's about taking the information that we learn in our science classes and applying it to a bigger picture. So that's why I personally love this major, and I love this club because we talk about all the different facets of, you know, all these different ways that you can do that, and all these different careers where you can do this, all these different, like today we talked about advocacy, you know, we're just learning about all these different ways that we can take the information that we know from data that there are certain things that help people live longer and live healthier and better lives. How are we going to help the most amount of people live these lives? So that's why I love this major.
Yeah, I was for this club, it's like a bunch of like-minded people coming together, and we all kind of like converse and we talk about issues that are important to us. And we also, like through this club, like there's a bunch of opportunities from like faculty that we'll like talk about, and like internships or research opportunities. And so it's kind of like a little like subset, like a closer subset of the whole major, and you get to like know people really well. And like I've just like made a lot of great relationships with people through this club and through our major. And like what Anna said, like it is a great kind of like middle ground between like science and people.
And also, if you're like interested in like even like the medical, like there's a lot of people in public health who like want to be like PAs or nurses or like other things. And so I personally think I want to be a nurse practitioner, and all the classes except for like 2 that are prerequisites for going to nursing school are already like within the major. So if you do decide you want to do something else with it, you can even like be pre-med and be a public health major. I just think it's especially important, even if you're going in the medical field, to have a background in public health, because I feel like it gives you a whole other perspective. Instead of seeing people as like a set of symptoms, you can actually understand that there are other social determinants of health, and there are other things that go into determining their health. And even like, for example, in our like in my obesity prevention class, like we're learning that like a lot of people with obesity don't like going for preventative services, because even if they go in for something else, their doctor will like bring up their weight and they'll talk to them about it in a way that they don't like, that's not like right. And so in our class, like we learn like the correct way to do those things. And I feel like if you're in just going to like med school, you're not learning about those things and other things like cultural competence and things that are really important that we do focus on in public health. So I feel like it gives you like a broader perspective, in my opinion.
Yeah, that was really nice because I'm actually planning on being pre-med. That's like my goal right now. So that's kind of like the reason that I chose public health. Like just generally, I kind of got that vibe about it. But like now that you're saying it, it makes me like more confident in my decision and everything.
Good.
Yeah, and then another question I had was like, I know that the public health like major is kind of like new. So like, is the department like pretty small? Like, what's the size and like how are like the resources like considering that it's new?
I'd say that even though it's somewhat new, so it's the kinesiology and public health department. Kines was very like public health geared even before public health came to Cal Poly, I'd say. I started as a kines major, and the reason I did was because I knew public health was coming to Cal Poly. And so I've switched to like a health promotion concentration. And so it's a very good balance. And it's the professors are more than equipped to like be teaching this. Like it probably should have switched to adding like public health a really long time ago. The research is all very public health geared, I would say. So I think it's a really strong department for public health.
Yeah, I think it's grown tremendously. My year was like the first year that it was an actual major. And I think that the resources are there for sure. Like I walked in as like Dr. Alber is my research advisor. And last year I just walked into her office after taking a class with her and I was like, do you have opportunities to do research? And she's like, yeah. And like, I've already published a paper with her and I'm publishing another one soon. And like, there's a lot of opportunities and like, she sends me like job opportunities and internships and like the internship that I have with the county right now, she's the one who sent it to me. So I think that the faculty really care about their students. Like I've never had a professor that I like couldn't go to and talk to during office hours and like anything. So I have these like really good interpersonal relationships with them. And all the classes that we've taken or I've taken so far have been like great classes and I've learned a lot. But they also kind of like build on each other. So that's kind of nice as well because you're like expanding your viewpoints on certain topics, but you have them from different perspectives, which is really cool.
That's awesome. Well, thank you. I mean, all this information really helped. So I just want to thank you guys. And yeah, I hope to see you next year.
Yeah, of course.
If you have,
Thank you for coming.
questions, other questions, like I don't know if you have our I can give you my email or we can give you our club email and you can like ask us questions and like anything that you might have.
Yeah, because I saw this Zoom link through Instagram. So like, do you guys like or use that? Like if I just DM you guys on that, will you guys see it?
Yeah.
Okay.
I run the Instagram, so I'll respond to you. Like
Okay.
I'll keep checking every few days. So if I don't get to you right away, like it'll be a day or like yeah.
Yeah, no worries. Okay, awesome.
There's
Thank you.
also if you send me a message, there is a post that I can send to you and it has our emails on it.
Oh, okay. Yeah, that'd be perfect. Yeah, I'll DM you and then
Yeah.
Yeah, if you could send that.
Sounds great.
Okay, awesome.
Yeah.
Thank you.
Yeah.
Bye.
Bye. Okay, so we were going to talk about officer positions, but I guess everybody left too soon.
Everyone dipped.
Yeah. So
Except for Gianna.
yeah, except for Gianna. So I guess we won't talk about it. People can send questions if they have questions, maybe.
Gianna, did you have any questions?
Yeah, do you have any questions?
How many positions are opening up?
All of them.
Oh, okay.
Yeah, there's a in the last email there was like the Google form, and so it's all of them. It's president, vice president, treasurer, secretary, event coordinator, and social media chair. So there's like 7. And you can nominate yourself for sure. And there is a little section of why are you nominating this person, but you don't really have to write that much for it. It's just to like make sure. And then the section for the email is just to make sure like Cal Poly students. And then after that, we're gonna send out an email to all the people who are nominated and ask them to send in like a 2-minute video, and then we'll send that out, and then we'll have everybody vote.
Okay.
And if there are any questions about any of the position duties or whatever, like feel free to reach out to any of us, and we'd be happy to answer all your questions.
Okay, thanks.
Yeah, for sure. I think we can just end this here. We have nothing else. But thank you all so much. Gianna, thank you for always showing up. You're literally the best.
Yeah. Yeah, Gianna, please consider running for a position because like
Yeah.
you've been consistently here this whole year and like that shows. So just really consider it.
Yeah,
Okay.
And feel free to ask us any questions.
Okay.
for sure. Okay, I guess that is all.